And from Dame Lesley Regan, who is the Secretary General of the International Federation of Gynecology and Obstetrics. She knows a lot about the WHO. She's travelled with them to many countries in Africa. I was taken by what the Director General said just an hour ago, that, you know, this funding, it's not principally about COVID-19. It goes to so many other fights that the WHO has with Ebola, with TB, with polio, and so many other diseases.
Yes, indeed, and one of the appalling consequences is likely to be, if President Trump continues this ban on funding, is that very basic services are going to be hit. You know, it's difficult enough for my team in a central London teaching hospital to provide good, high-quality maternity care and deliveries of babies. Imagine what this is like in sub-Saharan Africa and some parts of South America and Southeast Asia, when everyone's worried about COVID-19 and supplies are limited and PPEs are limited as well. You know, this effectively the WHO is providing services and support and advice to some of the most vulnerable countries and some of the most vulnerable people on our planet. And so we have to, this is a time for solidarity and collaborating across countries, not for becoming insular and just thinking about one's own country and one's own population.
Mercifully, we've not seen huge spread in Africa, and let's hope we don't. But if and when it does take a hold in Africa, and in particularly in sub-Saharan Africa, what sort of provision is the WHO going to provide?
Well, I think that's a very good question, because as we're hearing from countries such as the UK, from America, from countries in Europe, which by and large have very sophisticated health services and plentiful equipment. I mean, there will be some countries in Africa that have very, very tiny numbers of ventilators, and as we all know, what this disease gets you on is respiratory problems and problems breathing. For many people in the sub-Saharan African continent, there is going to be no life support for them, because they're not going to be able to access the equipment or the expertise to actually be using that equipment. So I very much hope it doesn't take hold in Africa, but you know, if we're looking at the trajectories of the other countries, cases have started arriving, as I understand it, and I think the consequences could really be catastrophic for those countries, those low and middle income countries that have limited health services.
And as Chris was just saying in his piece just now, you know, the White House has to understand, doesn't it, that we don't get rid of this pandemic until we all get rid of it.
Exactly. You know, the pandemic has come as a result of globalization. That's why the virus has spread so fast. And the only way to tackle this is a global effort to join hands collaboratively and help each other, learn from each other's mistakes, and then try and pull through it.
Dame Lesley Regan, really grateful for your time. Thank you for coming on.
Thank you.